I just love to create. I love to inspire.
A student drank 2 liters of fiber supplement for dinner. This is what happened to his intestines. CJ is a 22-year-old man presenting to the emergency room with nausea, vomiting, and constipation. He tells the admitting nurse that it was only a matter of time before he would take the biggest dump of his life. He had been building up since he hadn't had a bowel movement for at least the last 3 weeks. You see, CJ was a student who was obsessed with health. He was studying nutrition, and after reading articles on the internet, he was convinced all of his health problems like allergies, headaches, and insomnia were because his colon needed to be cleansed. He read online that humans should get 25 to 30 grams of fiber in their diet daily, but Americans only average about 15 grams daily.
Maybe you shouldn't be watching
He thought about
these.
every single day of his life where he was behind on his fiber intake. He liked
Helpful in
cereals
giving you
and
more
grains and
fears
fruit,
of
and those
nothing?
have some fiber,
gonna drink 2
but
liters
it's
of
not
fiber.
enough, he thought.
Well,
He
at least maybe
remembered all those
I would've
times in his
until I
life when
watched
his
this.
bowel movements were inconsistent, both in timing and in feeling
Well, now you're
on the
gonna be
way
concerned
out.
that your
If
next
there's
headache
skid
is
marks in the
because you have no
toilet, then it
bowel
must be
movement.
skidding in my colon too, and causing all of my health problems, he thought. CJ eventually came to his own conclusion that for every day of his life that he didn't get 30 grams of fiber, he needed to make up for it. He went to the pharmacy and bought large tubs of psyllium husk fiber supplement. At first, he tried a few spoonfuls mixed in with water, and for a few days, he felt great. His movements were regular and consistent. He could feel the cleanse happening. One day, he told himself that he was ready. He prepped his body and mixed at least 30 scoops of psyllium husk fiber with 2 liters of water. He watched it congeal into a thick jelly before putting it down. Immediately after finishing 2 liters of fiber supplement, CJ could feel his stomach expand. He had trouble drinking it because the fiber had a consistency of jello, so he had to chew it to swallow it. As the hours passed, CJ's stomach kept expanding. He felt full and didn't need to eat dinner. But then he realized the fiber supplement tasted like orange jelly and thought to make peanut butter and fiber supplement jelly sandwiches for a midnight snack and have the cleanest colon possible. Only then can my body absorb the best and healthiest nutrients during the day. But the feeling wasn't good. At first, he felt a little burning at the top of his abdomen. If the fiber jelly can be diluted with some extra water, then time to drink an extra glass, he thought, as he went to bed on an ever-expanding stomach. In the morning, CJ could still feel the fiber sitting in his belly, but from everything that he gathered in his online readings, that's how it's supposed to be. It needs time to scrub out years' worth of skid marks. Eating breakfast, then lunch, and then having more fiber for dinner would undoubtedly push it all down to wash into his intestines. But as the days passed, he noticed he was eating less and less. He felt more and more bloated and nauseous after eating. He realized that it had been days since he had a bowel movement. He tried convincing himself that it was the fiber doing a deep clean of his colon. Until 10 days later, CJ couldn't eat anymore. He couldn't drink anymore. All he could feel was his abdomen burning. To cope with the pain, he kept saying that it needed time to clean. But finally, the hurt became too strong. He could feel a giant lump in his abdomen with his hands, and when he pushed just a little bit on it, a sour taste would flood into his mouth from under his tongue, and he could feel his stomach cramp and shake. He would sit on the toilet until he could feel pins and needles prickling his feet, and nothing would move. He could feel a burning at the base of his neck. The pain became too unbearable, and he realized that something was happening as he calls for 911, and he's brought to the emergency room, where we are now. At examination, doctors found that CJ was agitated. He's breathing, he's conscious and responsive, so no problem there. His stomach was swollen. When doctors asked CJ if he had eaten anything, his eyes lit up and he told them that he had been cleansing his colon. He told them about some laxatives that he took when he noticed that he stopped having bowel movements. But then they asked him if he knew why he stopped having those bowel movements. He told them about the 2 liters of fiber supplement he drank but actually chewed, and peanut butter and psyllium husk jelly sandwiches that he ate for dinner.
Pretty yummy though.
And this gives doctors some clues as to what could be happening.
They just dismiss him, get the fuck out of here.
The husks of plant seeds. It's made of hemicellulose, which is fiber that in humans isn't digestible. Actually, cellulose found in plants is long chains of glucose sugar. Vegetable fibers generally don't taste sweet to us because we don't break them down to sugar, but in certain animals' stomachs, cellulose can be digested that way. Instead, in humans, this becomes what we know as fiber, which is needed to bulk up your stool and helps things more easily pass through the intestines, so causing the regularity you know about when it comes to eating enough fiber, which brings us to how psyllium works. In the small science experiment, I put psyllium husk supplement in a glass of water. The more psyllium that I put in, the thicker the water gets. It expands by absorbing water in. Human intestines absorb nutrients from food. You chew the food to crush it up. Your stomach mashes it up a little before sending it to the small intestines, where nutrients are absorbed into your liver for processing. The further down the food goes along the intestines, the more that has already been absorbed from it. If the large intestines are given enough time to absorb a lot of water, then the stool becomes dry and hard, causing constipation. But if fiber is present, then it puts more water into the stool. Psyllium helps to hold on, not only pumping water into the stool, but it also lubricates as it moves things along for nice smooth movements out. Yes. Moving things faster reduces the time for the colon to reabsorb water, so then there's no more dry stool. Fiber helps stimulate gut bacterial growth, which will help with digestion. All of this giving almost only benefits to the GI tract, but something's wrong. If psyllium is mixed without enough water, it becomes a thick, jelly-like structure. CJ told the doctors that when he took 2 liters of fiber supplement, he couldn't actually drink it, but he had to chew it because it had become like a jello. You see, when psyllium is mixed with some water, it becomes thick. That's the way it's supposed to work, by putting water into the stool. But the problem is, when it becomes like a jelly, adding more water doesn't actually cause it to dissolve or break down. Even squeezing it with your hands might not break it up. And because the GI tract isn't a rigid solid like the bones, a block of psyllium can expand in the stomach and in the intestines and push up against the sides of the walls.
Oh my god, there's so much fucking poop in there.
And because the psyllium expands and doesn't dissolve when more water is added, this blockage can cause an impaction. Even if the stomach and the intestines are big, long muscles, squeezing the psyllium won't cut it up. Adding more water isn't going to push it down because it's larger than the hole that it's in, and it keeps expanding. If it stays there, not only will nothing pass through, but as things keep piling higher, it can stretch the walls of the stomach and the intestines and limit the flow of blood. And because the gastrointestinal tract is a muscle that needs lots of oxygen to function, disrupting blood flow can cause parts of it to necrose. In the emergency room, doctors do a CT scan and find that parts of CJ's intestines were dilated, while others were collapsed. All of this suggesting that a high-grade obstruction was happening inside CJ as he was sent in for surgery. Surgeons make small cuts and send scopes in to CJ. They find the parts of his intestines that were swollen and blocked. Because psyllium isn't hard like a walnut or some other kind of rigid solid, they were able to cut up the blockage gently to break things up without cutting open his intestines. The manipulation and fragmentation were enough to clear the blockage and get things to start moving along as they sent CJ into the recovery room, where he did in fact have the largest bowel movement he's ever had in his life.
That's what you get out of this?
A mild dose of additional laxative was given to him by medical staff to just make sure to move things along as he was moved to the step-down unit. Psyllium fiber is generally regarded as a safe supplement. It's been shown in clinical trials and meta-analyses of those clinical trials to lower cholesterol and help with heart disease risk in patients with hypercholesterolemia. Hyper meaning high. Cholesterol referring to a waxy fat-like substance that's needed in your body to survive, and emia meaning presence in blood.
High full disclosure, drinking too much water can kill you.
Keep in mind, if you don't have hypercholesterolemia, the risk of heart disease is a little different than if you do. So taking a small amount of psyllium, as recommended on the label, if you even want to take it at all, is the best way to do it. So let me be clear. Some psyllium, as recommended by your physician or pharmacist, if you even need it in the first place, is okay so long as you follow the label. 5 grams, 10 grams a day should be okay. 500 grams in 2 liters of water, probably not okay. And thinking that you're cleansing your colon that way?
Debatable.
Probably not okay. I may or may not have blocked my own intestines a long time ago, so I might be speaking not only on CJ's experience, but my own. It really hurts, and if it can fix itself, it takes a really long time. Mix it with lots of water before you take it down. If you don't, you're going to block your colon at that point and create a need for surgery that you didn't need to have, just like in CJ's case. If you'd like to see more about how psyllium husk fiber becomes jelly, check out the video posted to my second channel, Heme Review, linked in the description below. After learning a lesson about fiber supplement and understanding that allergies, headaches, and insomnia probably couldn't be fixed by accidentally blocking his intestines, CJ was able to make
that,
a
and I'm
full
no medical expert.
recovery.
I did,
Thanks so
however,
much for
see a
watching.
video of a guy
care
who
of
trapped his ball sack and penis in a male chastity cage, and this has really,
What?
yeah, this really is super
No.
different than what the video was about. What?
Sorry, he ate 100 zinc vitamin C gummies every day. This is what happened to his spinal cord. Where is the connection? Continue, I'm sorry.
Well, no, it's not even worth it. It's been overshadowed.
No.
Well, I'm not going to talk about his dick and balls anymore.
Well,
But no, I haven't watched this one either.
it's intriguing me. I want to know what's
A
in
man
these.
ate 100
Plus his
zinc
spinal
vitamin
cord.
C gummies every day. This is what happened
That's
to
an
his spinal
expensive
cord.
habit.
They all
GC is a 55-year-old
All
man
habits are expensive.
presenting to the emergency room with a broken hip. His daughter Casey tells the admitting nurse that GC had been moving kind of funny over the
Thanks for
last
trying
few
cherry pie.
months. She heard a loud thud in the stairwell as her
Reset
dad
Ahab.
cried out, "Help, I've fallen and I can't get up." Earlier in his life, GC didn't pay attention to his health. When he was younger, he had some problems.
That's sweet.
His
Thanks,
classmates
Axolotl.
made fun of him because he was bigger than everyone else, and so he withdrew into his food. He developed into an adult who couldn't
These are
control
not real
himself as his
stories?
family found him hoarding excess
Yeah, they
food
are. What?
and secretly eating every last
I remember back
in his
when
30s,
one of the
GC
older
had
ones
health
even said
problems.
where it
He
came
had
from.
diabetes and gout. His big toe would hurt all the time. As the years passed, GC started losing feeling in his hands and feet because of his diabetes. One day, he stepped on something sharp. It cut his foot, and he didn't realize anything had happened until he saw red puddles in the shower. He realized he couldn't keep living like this. One doctor he saw wanted to start him on a variety of medicines. He refused, and after looking online, he found a doctor who recommended and would do gastric bypass
The details
surgery.
are slightly
This doctor
changed.
would cut into
Well,
his
yeah, he wasn't
abdomen
there
and
when this
create
happened,
a small pocket
so
of
yeah.
his stomach.
Imagine
then
there are
they
some
would reroute his
inconsistencies
GI
there.
tract into the end of his small intestines. The small stomach pouch limited the amount he'd eat so that he'd feel full while eating less food, and the reroute would limit the amount of calories he'd absorb. After surgery, doctors warned GC that he would need to control his nutrients because the bypass can cause some deficiencies in vitamins and minerals. GC's diabetes cleared up, but he started redirecting his excess habits. GC started getting cocky with his health. Fixing his diet made his blood sugar control better. Those
Do
doctors
some
were trying to
Lewis.
pump me full of meds for my diabetes, but I fixed it myself, he thought. 2 years ago, GC caught the flu. This was the sickest that he had been since changing his life. He vowed to never get ill again and started reading online forums about boosting immunity.
Zinc.
He remembered doctors telling him he might eventually have vitamin and
zinc's
mineral
good for you.
deficiency because of his
Yeah.
gastric bypass.
Appropriate
He came
doses.
across some online videos that told him zinc and vitamin C were absolutely the best way to keep the immune system strong. Everyone in this internet group made it clear this was undoubtedly the best way
Thanks,
to
Research
prevent
Jack.
any illness. And it's simply impossible
Thanks,
to take
Bit
too much
Cider.
vitamin C and zinc because they're water soluble, meaning that any extras will dissolve in the urine and be excreted from the body. And that's a great
Yep, I
guarantee
remember
that
that.
the kidneys will always catch any extras that the body doesn't use. He went to the pharmacy and started buying as many bottles of zinc and vitamin C as possible. He joked that he was reliving his past life, but this time was different. Instead of collecting high blood sugar, he was going to collect the strongest immune system ever made by humans. GC started with a combination zinc vitamin C gummies. These were delicious just like candy without the calories and only all of the health benefits. If there's no limits here, might as well eat the whole bottle.
I've
he
actually
thought.
had that
Anytime
exact brand.
GC felt a runny nose or sore
They're
throat,
very
he'd eat
yummy.
an extra handful of zinc vitamin C gummies. Sometimes the pharmacy would be sold out of his favorite brand of supplement. He read online that denture adhesive cream contained zinc, and if it was good enough for grandma to put in her mouth, then it was good enough for him to eat as a zinc immune booster. Anytime he was out of his preferred
Like an
vitamin
astronaut
brand, he'd
eating
eat a
toothpaste
tube
here.
of denture cream instead. 4 months ago, GC started feeling a numbness in his hands and feet, but it wasn't that he couldn't feel anything anymore. It was that all he could feel were pins and needles, like his hands had fallen asleep, but the pricks were 100 times more intense all the time. He had experienced this earlier in his life and thought it was familiar, but it wasn't. This was on top of him losing his sense of taste. His sides would start hurting. Sometimes it would pulse and he'd feel like throwing up, but he was usually able to keep it all down. One day, Casey noticed that her dad was walking kind of funny. She asked him about it, but he didn't know what she was talking about. Everything seemed to be okay, and he told her, "Don't worry, everything is fine," as he chewed on more zinc vitamin C gummies. As the days passed, the pinpricks and the pain in his side started intensifying. He had trouble not only walking, but also standing. And finally, when one day he struggled to walk down a flight of stairs, he fell. Instantly, he knew something was wrong with his hip as he cried out for help, and he's brought to the emergency room, where we are now. At examination, doctors find that GC is alert and oriented. He was clearly in pain, but he was
zinc
coherent.
gummies.
His brain
Quick!
is
You
intact,
have to save him.
so maybe he really did just slip. Doctor's main focus was to fix his broken hip, and surgery appears to go smoothly. GC is going to need physical therapy, but something's wrong. A blood test finds that GC's red blood cells are larger than normal, called macrocytosis. They can't ask him to stand because he just had hip surgery, but they find that the reflexes in his arms are more responsive than normal. His arms were also weaker than normal. His feet had some trouble sensing vibrations, and his daughter confirmed that all of this had been happening for at least the last few weeks. Since he was alert and oriented when he presented to the emergency room, then it means that his brain is fine. But reflexes in the arms go through the spinal cord. Feeling certain things in the feet also happen in the brain, but those impulses have to go through the spinal cord. All of this indicating that maybe he didn't just slip by accident, but that something is actually wrong with GC's spinal cord. And because he has a history of gastric bypass, then that problem could be caused by a vitamin deficiency. Another blood test finds that GC's vitamin B12 levels are on the lower end of normal. B12 is needed by the body to help the mitochondria in the cells make energy. It's also needed to make DNA, explaining his big red blood cells. Without enough vitamin B12, the nerves start to get damaged, and cells don't properly form because DNA parts aren't being made. Nerve damage explains why he fell while his brain is mostly intact, because his gastric bypass surgery didn't allow him to properly absorb nutrients, the doctors thought. They gave him some vitamin B12 injections to fix this, even though it seemed to be borderline. He got better, and he was discharged as his condition started to improve. When he heard about having vitamin B12 deficiency in the hospital, GC took this as instructions to double down on all vitamins and minerals. He needed another boost to his immune system anyways, because hospitals are dirty places, so might as well eat even more zinc vitamin C gummies to prevent any infections that could be from the hospital. As the days passed after several hundred zinc vitamin C gummies, GC's side started hurting again. His sense of taste started fading again. And then KC started to notice that he wasn't making as much urine as before. GC started acting funny while stammering about not being able to feel his hands and feet. And as KC walks in on her dad in his room, she finds him rolling around on the floor, confused, and he's brought to the emergency room again. At examination this time, doctors find that GC's kidneys are shutting down. Quickly, they find out that he has calcium oxalate crystals in the little bit of urine that he's able to make. These crystals don't dissolve in water, and they can build up and stick into the kidneys, blocking flow, not only causing them to fail, but also causing the tubules in the kidneys to necrose. Asking his daughter what GC's been eating, she was hesitant to say because she knew that her dad didn't trust doctors. She downplayed the zinc vitamin C gummies and made it seem like he took the daily recommended amount. Peanuts and spinach have a lot of oxalate too, and maybe that could be the cause if he ate a lot of it. Maybe he drank antifreeze or a lava lamp. Those get broken down to oxalate too. But this wasn't his only problem.
He loves
the
lava
nurse
lamps.
noticed that GC's movements were spastic. Neurology consult finds that his reflexes in his arms were more exaggerated than normal, and his feeling in his feet was diminished again. All of this looking like vitamin B12 deficiency again, but
Please reset, Maddie.
something's wrong. He doesn't have low B12 levels in his blood, and all chemicals associated with vitamin B12 were normal. And while his levels were low when he got his hip surgery last time, they really weren't low enough to be causing his problems. An MRI of his head was normal, but imaging of his spine suggested some kind of neurodegeneration, specifically the kind that happens during a long-term vitamin B12 deficiency. Nitrous oxide, if GC had been doing balloons recently, could cause inactivation of vitamin B12, causing deficiency.
We call them whippets.
But this isn't what happened. He doesn't have a vitamin B12 problem, and he never did. This same degeneration happens when someone has certain STDs, but he didn't seem to have those either. Doctors order another blood test and find that GC has low copper presence in blood. They ask him again what he eats, and they especially want to know what kind of supplements he takes. And when his daughter hears the question, she finally blurts out about her dad's excessive zinc vitamin C habits, eating hundreds of gummies every day, and even going so far as to eat denture paste to get additional zinc. And this tells doctors everything that they need to know.
They killed him
was
on
a
the
kidney
spot.
failure, specifically kidney failure
Walked
caused
in with
by
an executioner and beheaded him.
Vitamin C is broken down to oxalate in the body. In massive doses, it could cause kidney stones in men. We say could because this comes from a study involving a questionnaire about taking vitamin C supplements. And those men who did say that they took those vitamin C supplements had a higher incidence of kidney stones. So is that strong evidence? Maybe, but there is some scientific rationale that vitamin C does get broken down to oxalate in humans, and that could form a solid crystal with the calcium floating around in the blood, and these crystals can then collect in the kidneys. But based on the data that we have now, it's not entirely clear that vitamin C always does this to everyone. There are some cases when someone receives a massive megadose of vitamin C in the hospital and then going into kidney failure hours later, but sometimes it happens and sometimes it doesn't. The risk and the variable incidence is enough to say at least don't eat 100 vitamin C gummies or tablets every day, and this could be the cause
like someone that's
of
trying to
GC's
prevent you from
kidney
achieving
failure.
superpowers.
But kidney failure wasn't the cause of GC's pins and needles feeling in his hands and feet. His kidneys didn't cause him to walk funny, to fall down the stairs and shatter his hip. Kidney failure usually causes buildup of things in the blood because if they were working properly, the kidneys would be filtering things out, so that wouldn't cause low copper presence in blood. And the kidneys are not the reason why part of GC's spinal cord appears to have degenerated, bringing us back to copper and zinc. Both of these are metals. They're not heavy like mercury or lead, and that's a good thing because it means that they're generally more stable. More stable means less reactive. So zinc and copper are less likely to rip, tear apart, and destroy things in the body. Copper and zinc's place on the periodic table of elements indicates that they can have a positive 2 charge. Positive means that they're missing 2 electrons, a particle that creates negative charge.
That means it's a cation. Just in case you were curious. Whereas the opposite end of the spectrum is an anion. Well, I blew that.
The body doesn't like it when things have charges in the body because that makes them unstable and reactive. And so if copper is +2, then it means something with a negative 2 charge would act on it. On the periodic table, counting back from right to left,
would you like me to do the electron
elements
orbitals?
that have a negative 2 charge.
Do you even know
So
how
they
to-
have 2
I do.
electrons to give.
Sure?
Actually,
Oxygen
I'm
is
certain.
one of them, and that's
I'll do it
everywhere in the
after
body,
this.
but it tends to behave in a way that doesn't give out 2 electrons in this case.
Thanks to
Meaning,
some supernova,
sulfur
Nicholas,
is the
big
chemical
active
that
and
binds
random
to
dude.
zinc in the body. And because sulfur is in proteins, then this starts to explain all of GC's problems. Actually, metals reacting with sulfur is a central
Is he not
idea
having
for
any
why
liver
things like
issues?
lead and mercury are toxic
have to ask
in
him.
humans. In the cells of the stomach and the small intestines are proteins called metallothioneins. Metallo, referring to metals, and thionine deriving from theo, Greek, meaning sulfur. These sulfur-rich proteins neutralize metal ions that come from our diet. In normal function,
Brian
some copper in the
Finland
stomach
and
and
Amoose?
intestines bind metallothionine and get excreted in the feces. The remaining copper
Well,
gets
Dino.
absorbed into the body and is used for essential processes. If too much zinc is around, it tells the body to make more metallothionine. It has a plus charge too, and it's not too different from copper, at least from this standpoint. And more metallothionine means that all the copper is inactivated by it, and none of it gets absorbed in to be used by the body. This is a problem because the brain is the most copper-rich organ in humans. We know that the brain needs copper to develop properly because there's a disease called Menkes disease that prevents copper transport to the brain in young children because of a genetic mutation. People who have this disease see their brains deteriorate, atrophy, and never fully develop, and most of those patients never live past childhood. All of this explaining GC's neurologic problems that he developed since eating excess zinc every day. It simply forced his body to deplete all his copper stores, and without copper functioning in the body, the nerves start to degenerate. The damage could be permanent, but we still don't know exactly how all of this works. If CG is a fully developed adult and he's been eating zinc supplements to the tune of hundreds of zinc vitamin C gummies daily, and going so far as to eat denture paste for additional zinc, then that excess zinc is causing copper deficiency. The solution is to give him copper and tell him to cut it out with the zinc. You want to take some supplements to boost your immune system? Then fine, but don't do it by eating denture paste out of the tube or by eating whole bottles of gummy vitamins every day. And as the days pass with copper supplementation, GC's condition starts to get better. He's discharged from the hospital and is able to go to physical therapy for his hip. And as he finally learned a lesson about his excess, he made a recovery. Thank you so much for watching.
Very good.
Take care of yourself.
I get it, because
and
vitamin
be well.
C, he made a recovery.
No, that's just what he says when it's not a full recovery.
Oh.
Yeah.
He just said it like specifically A.
No, I think he does that to emphasize, like, he did not fully recover, but he did, you know, somewhat recover. Now he only eats 50 zinc gummies. Thanks to Tier 1 Awaken.
Well, I wonder if... So, maybe...
Switching these back. We put this one back.
Maybe it's different with humans and dogs, but I don't think it's different in this regard. I mean, dogs have copper storage in their liver. So I was curious how his liver was processing, if he was having copper issues.
Yeah, I'm not sure.
Yeah.
If it doesn't deal with electron orbitals or 10th grade chemistry, I just don't know what to tell you.
A TikToker chugged 8 scoops of pre-workout supplement. This is what happened to his brain.
He became a genius.
J.A. is a 25-year-old man presenting
Unlocked
to the emergency
100%
room
capability.
unconscious. His mother, Karen, tells the admitting nurse that she found her son unresponsive on the floor. You see, J.A. was a fitness TikToker who was just trying to make it. He recently found out about dry scooping pre-workout supplement. This was a hot new trend where people would dump powder directly into their mouth in an effort to bypass the water and allow the body to digest it as soon as possible so that the pre-workout would hit hard.
It's fucking horrible.
Clearly,
we used to do that as a joke.
Intended to sensationalize an unnecessary class of supplement, but J.A. was determined.
He
was going to dry scoop pre-workout for a video to post and get 100,000 followers.
Makes
After
sense.
putting 2 scoops of pre-workout directly into his mouth, J.A. felt like he was choking. He felt the powder immediately coat his tongue and everything became dry.
Yeah, it's like the cinnamon
challenge. In an effort
challenge.
to not breathe in any powder,
but worse.
He closed his eyes tight and tried to swallow. The video he posted gained him so many likes and new followers that he knew he had to push it further to get his follower gains. He was going to do 4 scoops next and have the biggest workout of his life, all documented in the biggest video that he's made yet. Immediately after putting 4 scoops of pre-workout supplement in his mouth, J.A. had instant regret. He knew he was going to choke on it, and if he didn't do anything, he would breathe it in. He thought it'd be funny for the video to just chase it down with 4 more scoops already mixed in with water.
Goddamn.
As he washed everything down and got ready for his workout. At the gym now, J.A. didn't feel well. The pre-workout he took was loaded with caffeine, creatine, and a Focus Energy blend made of a variety of things. He started sweating before he even
Hopefully
started
there was no
touching the weights.
beta-alanine.
He felt jittery during his
It would have
sets.
felt like he was getting
could
hit
feel
by
his
broken
heart
glass.
beating in his neck as his eyes started bulging out of his head. He knew he was wired, but it was hard to actually get anything done. And while he was doing one of his sets, he felt an instant headache break through. He posted his video online, but didn't follow any of the comments because he couldn't follow any of the comments. At home now, J.A. wasn't exactly sure what was happening as he stumbled around. And as his mom came up to see what the commotion was, she found her son huddled over on the floor as she calls for 911, and he's brought to the emergency room where we are now.
Yeah, it is
At
a ton of
examination,
caffeine.
no one knew that J.A. had chugged huge amounts of pre-workout supplement. Even if they knew, they'd have no idea what was really in that pre-workout supplement. What they did know was that he was unconscious and unresponsive. He wouldn't open his eyes, and when doctors and his mom tried calling out his name, there was no response. J.A.'s heart rate was high, his breathing rate was normal. When the nurse tried to take his blood pressure, the machine just kept cycling and it couldn't get a reading. When they tried to do it manually, the measurement came out
broke the needle
over 180.
Pre-workout turned him into a superhero.
And so high that the blood pressure machine couldn't produce an actual reading. In a previously healthy 25-year-old man, one reason why his blood pressure is so high could be that he took something, but his screen didn't return anything for substances, so it didn't look like he took anything illicit. A blood test finds nothing abnormal either. They looked at his heart rhythm and noticed that along with his high blood pressure, his heart was beating erratically. All of these together could mean that this is a problem with just his heart, but something's wrong. When doctors looked at his pupils, they noticed that one was bigger than the other. And the heart doesn't control the eyes, the brain does. And if the brain controls the heart too, then could the brain be the cause of his problems? Doctors sent J.A. to get a scan of his head. The images suggest that parts of his brain have been bleeding. Because the brain's enclosed inside a hard space, the skull, bleeding into the brain would mean that the brain's expanding.
Oh, he's getting smarter?
It's going to magically stop itself when there's no more space left. It's just going to keep going and keep pushing the brain up against the sides of the skull until the blood vessels start to crush themselves as the brain folds on itself, causing permanent damage. Is there a way that doctors can temporarily shrink J.A.'s brain to stop this? Maybe. Body water is a little salty, meaning that it has some sodium in it.
So they have to actually shrink his brain.
This is important because wherever sodium is, water will flow towards it. In this small science experiment, I dissolve salt in this water and place it into a tube. I submerge the tube in a pool of water that has no salt dissolved in it, and you'll see that water follows into the tube. That water follows sodium. If the brain is swelling, then a temporary fix could be to infuse saltier water into JA. If the body water is saltier than the brain, then it would temporarily suck water from the brain to relieve the pressure because it's quickly expanding. But this is only a quick fix for now, as he's sent into the intensive care unit. Doctors still don't know that J.A. had chugged 8 scoops of pre-workout because there isn't anything in that supplement that anyone in a hospital would test for, except his mom pulls up his phone and finds the latest video that he posted. She showed the doctors, and while it gives them some clues as to what could have happened, their main priority is to see if there's anything that they can do to relieve the pressure that's been building up in his skull. Looking at the ingredients of the pre-workout supplement, 2 things immediately stood out. A single scoop has 200 milligrams of caffeine, which is around 2 cups of coffee. The recommended daily maximum for caffeine is 400 milligrams. If J.A. swallowed 8 scoops of pre-workout in just a few seconds, it means that the caffeine content that he took was equal to chugging 17 cups of coffee, and equal to 4 times the recommended daily limit. Caffeine is a stimulant and increases adrenaline.
They could probably shoot lightning out of his hands.
It could explain why J.A. felt jittery. It increases blood pressure, which, if high enough, can stress the blood vessels to the point of rupturing the walls of those blood vessels, causing a bleed. But is caffeine alone enough to cause a blood pressure so high that the machine can't even read it? On the ingredients list was another listing named beta-phenylethylamine. It's featured prominently in the marketing materials of the pre-workout supplement. You may have heard of something called alpha-methylphenylethylamine, which sometimes goes by amphetamine. Something that's used in the treatment of ADHD that's related to an N-methyl-alpha-phenylethylamine, methamphetamine. In this pre-workout supplement, beta-phenylethylamine was described to be a focus maintainer to help promote mood, alertness, and concentration, similar to the function of amphetamine, but something's a little different here. In the brain, beta-phenylethylamine gets broken down or metabolized, but amphetamine doesn't get broken down in the brain. It stays in, and the body needs to wait to clear it out. This is a problem because in the synapse where nerves connect, chemicals normally send signals. When the signal is done, the synapse needs to clear itself so that signals aren't sent non-stop. This means that those chemicals that send the signals either need to be pumped back in or broken down. If a lot of amphetamine is present, the synapse doesn't get cleared. It keeps forcing more chemical out, sending signals non-stop, continuously stimulating the nerve. This is why we call it a stimulant. Amphetamine doesn't get broken down in the brain, so it stays there until it naturally clears out after a while. But beta-phenylethylamine, the chemical that was in J.A.'s pre-workout, is supposed to get broken down in the brain quickly, but when J.A. chugged and instantly swallowed 8 scoops worth of pre-workout, there could have simply been too much of it for parts of his brain to break it down quickly enough. This is a problem because that signal from the nerves also gets sent to the heart, telling it to beat harder and faster. Huge amounts of beta-phenylethylamine probably can't get broken down quickly enough, so the signals aggressively push into the heart, causing it to beat harder and faster. But it's not just the heart doing this. JA's blood vessels are constricting too, and when they constrict as the heart is beating harder, this dramatically increases the blood pressure even more. The combination of huge amounts of caffeine and beta-phenylethylamine in 8 scoops of pre-workout swallowed all at once, with heavy lifting, all together, could have increased JA's blood pressure so high that it caused his brain to start to stroke in the form of a bleed. The dysfunction of the brain caused dysfunction in the heart, which was found first by the doctors as they were trying to figure out exactly what was going wrong. Doctors were able to prevent J.A.'s brain from pushing up against his skull and oozing out of the cracks. The surgeons removed parts of his skull to relieve the pressure building up in his head. But the images show that he didn't have any physical abnormalities that would have caused his brain to bleed like this. His past medical history also didn't show that he was susceptible to this because he was a healthy 25-year-old man. Despite the doctors and surgeons at this point really only caring to fix the problems caused by his brain bleed, the reality is, despite evidence strongly suggesting that caffeine and beta-phenylethylamine are documented to cause hemorrhagic strokes when taken inappropriately, there's always a little bit of doubt that it was absolutely those two alone that caused JA's problems. You can't set up an experiment to test on people by giving them huge amounts of these things and waiting until their brain starts to bleed because you're intentionally harming people. And you might not be able to fix the problems that you're going to cause to them by doing that. Which brings us to the final problem of JA's case. Supplements sometimes tell you on the label to consult a physician before taking it, that you should consult a physician before starting any exercise program, and the reason why you're probably going to be told to not take it is that we don't really know what's in here. Some of the brands might change the ingredients, we don't really know what's in these complexes and these blends, and change the amounts of those ingredients.
Yeah, so,
they don't have
hold on, not to blue ball you real quick, I noticed that the other day. I don't remember what the fuck was it? Because me, Matt, Chelsea, and Danny were talking about that. It was some drink that one of them brought in, and it had literally nothing listed. So if you just look at the drink in the back, it has nothing. Like for nutrition, there's nothing there. And we were wondering how illegal it was. I can't remember what the fuck it was, though. It was from like a gas station. I don't remember what it was now. No, it wasn't water, asshole. It was, I don't remember what the fuck it was. It was like a tea or something. Thanks to the Prime Greylock and the resub in run.
I have to tell you about it. These complexes and blends might be sourced differently depending on what state or country that you're from, and some of these might be based off of herbal ingredients that interact with your liver and cause problems.
That's how they get around with it. They just call it like a
taking for an
proprietary blend or something.
This is coming from someone who is in medicine and also spent like 15 years of my life in powerlifting circles. I stepped on the platform to compete. I used to take supplements, and when I was competing, pre-workouts like this were just becoming a thing. Not many of us took it where I was, and we certainly didn't dry scoop it. There's no such thing as bypassing water to digest it faster. There is such thing as bypassing the liver, but that would imply that the pre-workout is being absorbed into your blood directly through your cheeks and under your tongue, which for granular powder like this isn't happening. You're voluntarily creating a choking hazard for yourself by doing this. It's a troll. If dry scooping is somehow a convenience for you in some way, that's great. But don't lie to yourself thinking that taking it that way is doing something special. If you're really training seriously,
argue with the TikTok
you shouldn't
professionals.
need anything extra to help you focus on training because this is a non-essential supplement. JA may not have had the support structure of a team at a gym to gain that insight, but the label of the pre-workout also says don't take more than 2 scoops in a given day. Don't push it with this kind of stuff. When stabilized after surgery, J.A. was moved into a step-down unit where he appeared to improve, likely thanks to the fact that he was younger, previously healthy, and his stroke may have been caught just in time. He was moved to a rehabilitation facility afterwards, and after several months of care there, he was able to make a recovery. Thank you so much for watching. Take care.
Interesting how he didn't say full
well.
recovery. That's odd. But at least he made some kind of recovery. Make sure to smash that like button and thumbs up, ring the bell, tell your mom I said hi. chef ate gas station nachos for dinner. This is what happened to his limbs.
A chef ate gas station nachos for dinner. This is what happened to his limbs.
Thanks, Reset
GP
King.
is a 34-year-old man
You're right, Slip.
presenting to the emergency room with shortness of breath and blurred vision. He tells the admitting nurse that he knew something was wrong when he thought he had to burp, but a lot more than just air came up. 2 days ago, GP left home to go on a road trip. He was a chef who recently sold his failed restaurant. His life was going nowhere, so he left home with no intention of ever coming back. At a gas station, hours later, GP needed to make a pit stop. He was hungry. Coming from the culinary world, he had high taste in food, but nothing like some sketchy nachos and roller hot dogs for dinner, he thought. Immediately after finishing his gas station dinner, GP felt wonderful. He stopped at a nearby motel to finish his day. On the road the next morning, GP didn't eat breakfast because he felt like there was a rock in his stomach. As he kept driving, he noticed that it was getting harder and harder for him to breathe. His throat and chest were getting tighter. He had a history of asthma and allergies, and he's in an unfamiliar place now, so maybe close the windows, he thought. As the hours go by, GP becomes increasingly short of breath. A tingling in his fingers begins to develop into pins and needles as his vision starts to double. As he pulls into the hospital parking lot, he feels the mass in his stomach getting heavier as he dry heaves again on the pavement. He crawls into the emergency room where we are now. At presentation, GP appears ill and uncomfortable. His skin is flushed and he complains of dry mouth. Both physical and neurologic exams seem to be normal. His heart rate slightly elevated, his blood pressure a little low. If he's in a place that he's never been to before, having eaten food that he normally doesn't eat from a place that he's never eaten at, then this kind of sounds like an allergic reaction, a little delayed in onset after eating his gas station dinner of nachos and hot dogs. This anaphylaxis is pretty easy to treat as the medical team starts to give him medicines for it. They start with diphenhydramine,
but it turns out the
also known
nachos
as
are just giving him
Benadryl. This blocks a
superpowers.
chemical called histamine, which explains why it's harder for him to breathe now. Histamine is released when the body finds allergens, which is something that causes the immune system to react inappropriately. Inappropriately in that it causes the blood vessels to dilate, allowing more of the immune system to enter the site to react with those allergens. And the swelling is happening to his tongue. It's closing up his throat. It's making it harder for him to breathe, so blocking histamine should stop this from happening. If his blood vessels are dilating, then we need to constrict them, so GP was also given epinephrine or adrenaline to tighten up all his blood vessels, causing vasoconstriction, to counteract the vasodilation because of his allergic reaction. He was rehydrated with intravenous fluids as he seemed to recover. But several hours pass. GP's vision starts to double. He describes what sounds like heartburn to the nurse. 2 more hours pass and an oral antacid solution arrives from the pharmacy for him to drink. This tastes like chalk, he thought. I really don't want to drink this, he thought. A few sips and another hour in, GP is physically no longer able to drink the rest of the mixture as he becomes unable to swallow. He frantically tries to signal this to the nurse because he's no longer able to speak now. Immediately, the medical team reevaluates GP as they draw blood from him to test. He can now only communicate with them in writing. He tells them that he feels like he's suffocating. His eyelids start to droop as his heartbeat is now a little bit elevated, and surgery and neurology doctors are called in. A new examination finds that GP's reflexes are still normal. His senses are still intact, but the muscles of his eyes now have some weakness on abduction. An MRI of his brain returns normal. Nothing's wrong here. Over the next 3 hours, a wheezing sound could be heard from GP as he tries to breathe.
What
Weakness
in the
of his
fuck
face and
is
tongue
happening?
worsen as breathing becomes dangerously shallow. An examination of his throat finds that he's unable to swallow not because it's swollen, but that the muscles of his throat are actually paralyzed, meaning that whatever is happening to him, it's definitely not.
Well, I'm never eating at a gas station again.
Weakness in his arms and legs were found as he's admitted into the intensive care unit. At 36 hours after eating his gas station dinner of nachos and roller hot dogs, GP is no longer able to use his arms and legs. He's no longer able to breathe on his own as he's intubated and a tube is put down his throat for a machine to breathe for him. He can still hear. It looks like he can still respond to pain, but he's now trapped in a body that can't breathe for itself, that can't speak for itself, and can't move by itself. This rapidly progressive, generalized weakness descending from the muscles of his eyes to the skeletal muscles of his limbs gives the medical team some clues as to what's happening. GP's brain MRI returned normal. The weakness that he developed was symmetric, meaning that it was about equal on both sides. Together, this means that there probably isn't anything wrong with his brain or his spinal cord, something that we would call a central cause of acute weakness. The central nervous system is made up of the brain and the spinal cord, and it's responsible for this.
What the fuck was it? Was the nachos were so good the body couldn't process it anymore and shut down?
But he can't speak to them because his throat is paralyzed. He can't see them because he can't open his eyes. He might be able to smell them, but he can't breathe on his own because those muscles don't work anymore too. And because the peripheral nervous system operates on the muscles, then this could be where his problem lies. But how did this develop? In the emergency room, medical staff saw his problems progress from nausea and double vision, shortness of breath, to being unable to swallow, unable to speak, descending rapidly to muscle paralysis. If he no longer has control over his motor function, then this means that the problem could be first coming from his nerves only, it could be coming from his muscles only, or the problem is from the junction of where the nerves connect to the muscles. There aren't too many things that are a problem of just the nerves that cause muscle paralysis and doesn't affect the brain. Polio is a virus that destroys the nerves and causes paralysis. West Nile virus does it too. But these are just like any other infection at first, meaning that it would cause things like a fever and respiratory illness lasting a few days before causing motor dysfunction. But GP never reported a fever or recent past illness, so this is probably not a problem of just his nerves. But how about his muscles?
What in the fuck did the nachos do?
Don't usually affect the ocular and respiratory muscles together.
Was it an assassin?
Probably clear here too. But how about the neuromuscular
They do tier 1 feed.
This specialized region is where the nerves
I know the lumberjack sports.
communicate with the muscles. If nothing is wrong with only the nerves and only the muscles, then it means that GP's paralysis could be because no signals are being relayed between the two tissues. You see,
Piss
muscles don't
nachos.
contract by themselves in normal function. There has to be
He's clearly
motivation
presenting with
behind
piss
it.
symptoms.
Your brain controls
He drank
the muscles,
piss.
and it's the nerves that deliver that signal to them by releasing a chemical at this neuromuscular junction. We've already established that GP's brain is fine, meaning that somewhere in this line, that signal is getting lost. What if the messenger chemical is there to deliver, but the muscles can't receive it? This would happen because the body's immune system has attacked the parts of the muscles that receive that signal. But if the immune system is involved, the sharp decline in function isn't going to happen as quickly as 48 hours. GP would have also had a past history of this disease. It would have been obvious, but he doesn't have it. So we can assume here that his muscles aren't damaged and he can receive those signals, meaning that his problem is because his nerves are not able to release the chemical to signal to his muscles to contract. Specifically, the decline in function started with his ocular and respiratory muscles descending to his limbs, meaning that the proteins that control the chemicals released from the vesicles is being disturbed by a toxin. This disease is called botulism. As the blood test results from his ICU admission return 4 days later, GP returns positive for Clostridium botulinum, the bacteria known for producing the botulinum toxin, which cleaves the proteins involved in the nerve vesicles that release chemical into the synapse of the neuromuscular junction, preventing the signals to the muscles, paralyzing all of his muscles, and causing his respiratory failure. But where would this bacteria come from? Downstairs in the hospital, in the emergency room, another patient presents with the same paralysis.
Oh, Jesus Christ.
Motor weakness and respiratory failure.
That gas station was...
Days later,
where did they eat it? Chernobyl?
Test positive for Clostridium botulinum, as the State Health Department and Center for Disease Control were already contacted in advance because this reportable disease must be notified to authorities in case of an outbreak, because possible widespread paralysis of many people can have very bad outcomes. Antitoxin was received from the CDC and administered to GP as soon as the medical team suspected botulism. This protein binds the toxin floating around in his circulation and prevents the nerves from absorbing any more of it, but the antitoxin isn't able to reverse the damage already done. It cannot do anything about GP's paralysis or his respiratory failure. The CDC tracked the past activity of GP and the other patient. The common activity between the two was consumption of food from the same gas station. Laboratory analysis of the nacho cheese found Clostridium botulinum and was determined to be the cause of this outbreak, as 8 other people in the local area were reported to have the same poisoning. This is an incredibly rare source of
Holy
botulism, which
fuck.
typically comes up in canned food, because for the bacteria to become active and produce actual toxin, both the temperature and the pH of its environment must absolutely be spot on. And in this case, some unfortunate mishandling of nacho cheese enabled it to be spot on, as it affected all these people. The thing about botulinum toxin is that you might know it as Botox, the most potent toxin known to humans, which happens to be naturally occurring.
Oh my
And potent,
fucking
meaning that
god.
the smallest amount, on the order of less than 1 nanogram or a billionth of a gram, can be fatal. Meaning humans have obviously found out ways to use it therapeutically. Because it prevents the release of the neurotransmitter acetylcholine at the neuromuscular junction, it inactivates the muscles that pull on the skin. Some of those are the ones that cause wrinkles. But it doesn't just stop there. Sweat is modulated through a similar process, and botulinum toxin injection produces a temporary chemical denervation of the sweat gland, resulting in local reduction in sweating. In sensory neurons, botulinum toxin interferes with the nerve's ability to communicate pain through modulating the release of acetylcholine.
I will
thus
never
creating
eat
migraine
gas station
injections
food
in
again.
Specific areas of the head and neck.
Or
All
hot
these
food
can
from
work as
anywhere.
injections and not spread throughout the body because they're delivered locally and the toxin doesn't travel very far. But for GP, he ate it in the gas station nacho cheese. It absorbed through his stomach and small intestines as it entered into his circulation, spread systemically, and bound to neuromuscular junctions, impairing oculomotor function, paralyzing all 4 of his limbs and his respiratory muscles as it wreaked this havoc over a time span of just a couple of days. If therapeutic Botox injections only last for a couple of weeks before wearing off, then the good news for GP is that even if the antitoxin can't reverse his paralysis, the toxic effect will eventually wear off. But when will it exactly? Over the next 3 weeks, GP stayed paralyzed and on mechanical ventilation. The first sign of improvement was when he was able to slightly abduct both of his eyes. Then slowly, he was able to keep his eyes open, move his tongue, and breathe on his own. And after spending 6 weeks at the rehabilitation hospital, GP was able to return home from a road trip that he never intended to return from, with limited mobility and function that fully returned after 6 months. Thank you so much for
Holy
watching.
shit.
Don't take it if it's nacho cheese, and be well.
I will never eat. I was literally. So Matt and I were going to do a gas station food tier list at some point in the next couple months. Just because we thought it'd be goofy and we thought like the worst foodborne illness you could get was like shitting a lot. I am canning that idea forever. Holy shit. Thanks to the tier 1 cats and bacon. Wow. Fuck, I had Olive Garden today too. I had fettuccine Alfredo. Now I'm worried about the cheese in that. Oh, Jesus Christ. These videos are bad for me as a hypochondriac. Oh my god. God damn it, now I just keep thinking about it. Fuck! How long did it take for his shit to kick in? It was like almost instant, right? Like it was within like an hour or something? No, like when he first started feeling shitty from it is what I mean. Yeah, it was like something pretty quickly where he started feeling like bad. What the fuck is Faziolis? Or Fazoli's? I work at Fazoli's and assure you the Alfredo is fine. How is that helpful? I don't know what Fazoli's is. Don't worry, Charlie. I actually work at an Amazon warehouse. I can assure you, the Alfredo at Olive Garden is fine. Damn it. No, I just keep thinking about it. I knew I shouldn't have watched this one. When I saw this title earlier, I was like, this is a bad idea. But just like George, I got curious, man. I will never eat gas station food again. That's for damn sure. Your wife is forcing you not to Google it. At least I'm not alone in the fears. Fuck. Yeah, so like the goofy ones I'm fine with, because like when am I ever going to drink 50 beers in 6 weeks? Or when am I going to do a fucking bottle of nutmeg challenge? 2 gallons of coffee? Like when am I ever going to do that shit? But fucking what was it, botulism? From a goddamn cheese? I eat cheese from places. That's scary. And it's just like a complete random chance. Son of a bitch. Let's watch this guy eat 25 packs of silica.
A dad ate 25 packs of silica gel for breakfast. This is what happened to his stomach.
Well, you know what? I wasn't the only one that ate
KC
Alfredo, too.
is a 33-year-old man
Well, I guess we'll
presenting
see.
to the emergency room with nausea and vomiting. He tells the admitting nurse that he was prepared. It was only a matter of time before he could escape the simulation and join everyone else in the real
Yeah, I'm
world.
familiar, Jake.
You see, KC was a single dad who worked hard to provide for his kids. Over the last 10 years, he had survived several rounds of layoffs at his office job. But even in surviving every single company change, KC could never get a promotion. He tried to take special projects, he tried to make friends with the leadership, but nothing he ever did amounted to any actual movement in his career. All his friends from school were getting bigger and better titles. They were getting paid, but he was stuck at the bottom doing the same job as he had had for the last 10 years. Disillusioned, Casey started to despise both people at his company and corporate anything. Anytime he saw some kind of messaging on an ad or a warning on a label, all he could think about was how much he hated big companies. One day, Casey hadn't slept well.
Fuck
He woke
corpo.
up and he wasn't sure where he was. On the table was a big bag of silica gel desiccant that he had left overnight for his 3D printing hobby. And as he saw the warning on the label silica gel, do not eat, his immediate contempt for corporate took hold. As he was brushing his teeth, he got angrier and angrier that those packets were speaking to him. Those
What?
silica gel industry big shots can't tell me what to do, he thought, as he put 25 packs of silica gel in a bowl of milk and started eating them like cereal. Immediately after putting some silica gel packs in his mouth,
All right.
KC could feel the crunch on his teeth.
And yeah, she did
Immediately
say that,
stuck
Mig.
onto his tongue as his mouth felt like a singularity as the beads started sucking
And
every
maybe
bit of
cephalopod.
moisture out. While chewing, he thought the packets tasted bitter, and he could feel the sharp edges of the chewed beads cut down the side of his throat as he swallowed them down. KC felt the beads settle in his stomach as he reluctantly opened his work laptop to clock in for his job. But as the minutes passed, he started feeling uncomfortable. He felt a sour taste pierce into his cheeks from under his tongue as he started vomiting in a way like never before. At the toilet now, he could taste the silica gel and milk that he ate for breakfast come up. In the forceful upwards movement, those beads lodged into his nose. He could feel some beads squeeze in from under his eyes like they were pushing at him
Whoa.
his skull. On the floor, in the bathroom, in a world of hurt, KC knew it wasn't over as he calls for 911 and he's brought to the emergency room where we are now.
Well, maybe, Thule. And thank you for the
At
dollar, of
examination,
course.
Doctors find that
Good luck on
KC
finals.
is distressed. Other than the vomiting and nausea, everything else seemed to be normal. He's breathing, he has a heart rate, he's alert and responsive. He kept telling staff that he was ready to escape the simulation and join everyone else in the real world.
Oh boy.
Which gives
One of
doctors
those guys.
as to what could be happening. This possible mental status change could mean something, but Casey is otherwise coherent, except for the fact that he kept telling the nurse that those silica gel industry hotshots can't tell him what to do. When doctors asked him what he meant by that, he told them he ate 25 packs of silica gel for breakfast. He poured it in a bowl of milk like it was cereal and ate it. And this tells doctors everything that they need to know.
It takes a very strong man to hear that and then try and save that
Di
person.
meaning two, and oxide referring to oxygen. Silicon being one of the most abundant elements on Earth, not to be confused with silicone implants. Silicon and silicon dioxide are naturally occurring and are in things like sand, while silicone is not naturally occurring. And silicon and oxygen are some of the most abundant elements available on the planet. But why is silica gel a desiccant? What even is a desiccant? Well, you see, these packets are usually found in packages that you want to be dry.
If it was
Beef
even
jerky is
real.
an example. Camera
These are, I don't know why
another.
people keep saying
This
this.
is
These are
because
real
moisture
stories.
in the air can make food like jerky taste stale, and it can cause mold to grow on camera lenses. Desiccant means that silica gel removes moisture from ambient air, but how does it do that? This brings us to an idea
Lazy Reset
of
Finnick.
like dissolves like. Oils mix together, water-based things mix together, but water and oil, those things don't mix together. In chemistry, oxygen and hydrogens play with each other. They attract each other, even when bound to other chemicals. So, if water is made only of oxygen and hydrogen, water is dihydrogen monoxide, then this could explain why water-based chemicals dissolve each other. But oils are made of carbon and hydrogen. Oils don't really have much oxygen, and without that oxygen to play, oils separate themselves out.
He's a tier 1
They
Koopa.
don't interact and they don't dissolve. So if silicon dioxide has a lot of oxygen, then it does interact with water.
Sweet. Thanks,
In
straight
the little
vibing.
pores at the surface of the beads, small
Next to
water
tier 1
molecules stick onto the surface.
Dumonics.
Little pores give extra surface and more space for even more water to stick to the bead. Because the area is so large, silica gel takes on large amounts of water relative to its weight, drying out its surroundings because silicon dioxide holds onto water stronger than air does, explaining how it's a desiccant. But why does the packet say, "do not eat"? The interesting thing about a label like this is that in English, many people read it as something in here is poisonous if you eat it. Typically, if something's a choking hazard, the label says choking hazard. But it doesn't say that here. And even worse, sometimes people will do things, especially when they're told not to do it, just like in Casey's case. But what exactly is poisonous here? This brings us back to silicon dioxide. In chemistry,
Thanks, Resub
when
Crazy
things are
King.
unstable, they're reactive. The reason they react with something is to become more stable. Poisons do their damage in the body by doing that, reacting. This could happen by blocking a naturally occurring process required to live, like
Thanks,
how
Resub
carbon
Big Booty.
monoxide stops oxygen from being
Prime.
transported in the red blood cells.
Fellow.
Poisons can react by permanently destroying something in the body, like accidentally drinking a lava lamp that makes crystals with calcium from your body. that
Oh, you
slip
spoiled
into
that
your
one.
kidneys and shred them apart. The thing with silica gel is that it's already stable. It doesn't need to react with anything. Actually, it's so stable that it won't react even if your body tried. It pulls water, but that's reversible. You can reuse packets if you heat them in the oven, meaning, by itself, silica gel is not poisonous in the body. The reason you're not supposed to eat them is because it could be a choking hazard. It could block something in your stomach if you eat enough of it, but generally, you don't eat it because why would you? It doesn't do much to your body except maybe
Thanks,
absorb
Resub
some of
Zombie.
the water that's in your stomach. And if you're thinking of eating
Happy
something
late birthday.
weird, your mind is a powerful construct, and you can easily convince yourself to push it back out, which brings us back to KC. In the emergency room, doctors realize that nothing terrible is going to happen to Casey because he ate silica gel packets.
What?
The silica beads will suck water out of his stomach so doctors can rehydrate him, but no toxic activity will happen in his body. As soon as they
Oh, I didn't
figured out
expect
he didn't
that.
put anything else that could be a problem in his body, they referred him for a psychiatric evaluation. Silica gel ingestion cases do happen. It's actually not that uncommon, despite that well-known warning label. 38,000 people were reported to have eaten them in 2009 in America. And interestingly,
What?
enough, 34,000 of those people were under the age of 6. So parents, keep in mind what your kids are eating. You don't want them
I am
to
shocked.
simulation on you. And 38,000 was only the reported number of cases. It's probably much more than that actually happened. In kids, the beads can be choking hazards. Some other kinds of silica gel may have coatings on them, which could be toxic, but it's usually not in large enough amounts to do permanent damage. Silicon dioxide is actually found as an additive in food, so we all do actually eat some silica in other forms, but don't eat this. You don't know where it's been. KC found out the hard way there is no simulation and no real world other than the one that he was living in after eating 25 packs of silica gel, at least this time around, as he was discharged from the hospital and he made a full recovery.
I can't believe that.
Thanks so much for watching.
What
Take
is
care
the
of
point
yourself.
of those little packets,
well.
though? It's supposed to be for freshness, but how does it keep anything fresh when it's inside of the fucking bag? Why do you keep saying take a peek at the community tab? Oh, nice. That's pretty good. No, I understand. Like, I'm trying to add, how does it work when it's in a bag? Like, I understand it's supposed to be for taking out, like, moisture and shit, but I don't see how it works in a bag. Oh, there's little holes in the bag? Oh, didn't know that. I've never actually touched one of those. Whenever I see them, I just assume it's poison, and I don't eat anything that touches the bag.